And I find out that Mr. David, I need to do catheter for him because he just have a appendectomy catheter.
David. Yeah.
Appendectomy surgery, right? So I wash my hand, check for patient's allergy, if they're allergic with iodine or shellfish, because I have to do catheter on him. Check for any medical history and medication allergy. So, and then also I check if the patient is diabetic. I have to check CBG check first, and also check he has symptoms of depression. So sometimes their kind of behavior. Check if there's a purple dot on the room, and then I knock the door. Good morning, Mr. David. I'm Sharon. I'm your nurse for today. I'm here to help you for your assessment. Is that okay? And he said yes. So at the same time, I have to check safety check. There's no clutter on the floor. The floor is lower and then locked. And if they have oxygen, it's flowing good. The IV is dripping well. If they have bladder, it's supposed to be on the. If they have a catheter bag, it's supposed to be in the lower of the bladder. And patient LOC and LOO, they're not cyanotic. Chest is rising up and down. Orientation is good. They know where they are. They know who I am and they know their name, something. And also provide privacy. And then check for patient. Mr. David, can I check your ID band, please? And then you have to make sure to check always for the ID band, especially in nursing home. They have lots of name alert, same name and last name, so it's too dangerous, right? So that's the most important thing. So while I'm assessing him, I have to do catheter, right? I don't want to do the bubbly. I'm done with it.
Everything. For David, you're doing David.
David is male.
No bubble here. No bubble.
So just
No,
I have to
no
do
bubble.
assessment.
Yeah.
And then the catheter. I want to do catheter now because I'm done.
No, you haven't done had to do assessment.
Okay. So I'm gonna tell him that I have to assess it. Do you have extra gloves?
Sorry.
So yeah, I have to make sure to wear my gloves because now before I do anything else, I have to make sure for pain assessment. Ask him if he's in pain. How long do you feel some pain, Mr. David?
Since 5 minutes.
5 minutes ago. So, and then is it radiating? Is it going somewhere?
Yeah, it's just going from my right abdomen to left.
Okay. And then like what aggravates? Like if you move, it's getting worse, something?
No, I'm not moving at all.
Okay, so it's like, how do you describe the pain? It's throbbing,
It's sharp.
sharp pain. Okay, so, and also, what else? Can you scale it from 1 to 10?
Yeah, it's about 8.
8, okay. So, and then you have to make sure to check for the MAR, how long to take the medication, because you cannot give a hydromorphone or strong medication 4 hours. So it's like, how long did you take your last meds?
4 hours ago.
Okay, 4 hours ago, so we're allowed to give his medication right now. So do you want me to give your meds first before I can start my procedure?
Yes.
Okay, so I have to make sure to put my bed in lowest position, right? And put the call bell within reach, and then I can go and get ready my medication. So I have to give him hydromorphone, right? Do you want me to go there or just pretend?
Up to you.
Up to
I
you.
just pretend because it's too much.
Yeah.
So when I do medication, I have to make sure to check 3 checks. It's very important, okay? So first, yeah, like, right medication, right person, right time, right road, right dose, right reason, right documentation. First check, second check the same, and the third check it's
You want to do it?
it's okay, I can do it. I'll do it later. So now I want to focus on catheter. Okay, Mr. Smith, David?
David.
I can put your bed up again. So we're gonna do your catheter, okay? So how do you feel? Do you have a good sleep last night?
Yeah.
What's this, pretty? Why I didn't put it up?
Yeah.
We're already 4th semester. We don't even know how to put the bed up.
I don't know even how to take this off.
Yeah, right?
The Chris taught me.
So yeah. All right, Mr. Smith, Mr. David. So after you get medication, it's sub-Q. It's gonna be effective 10 to 15 minutes. But if it's IV, it's gonna 5 minutes, and then if it's PO, it's gonna be 30 to 45 minutes.
Yeah.
Now I'm done for 15 minutes, so I can go back. How do you feel your pain right now, Mr. David?
It's better. I'm
Oh,
feeling 4 out of 10.
Okay, good. So yeah, so we can start your catheter now. Okay, you have a doctor's order for catheter because When is your last void anyway, Mr. David?
6 hours ago.
6 hours ago. Okay, so do you feel any pain in there when you
Yes.
go pee?
Yeah.
Also check for bladder distension. Check for any pain, skin integrity. And you can do the bladder scanner, how much pee. So I find out that he had 800 cc of urine. So we have to do catheter on him, okay? Explain to the patient all the time, even they don't understand you, even they're not cognitive at all. It's how you respect and dignity of the patient, right? So I'm getting ready my thing. Mr. David, I need to wash you, give you a pericare first. So for male, it's only abduction, right?
Yeah, but pretend this is female.
Okay, so for female, you have to do dorsal incumbent first. And then while you open it, make sure to check skin integrity again. It's very important. Sometimes if they're obese, there's lots of redness and itchiness there. Give a good pericare to avoid contamination. You wash in the other side. Change your towel this side and then in the middle. And always change your towel and then path dry all the time, okay? So I find out that it's good now. Remove my gloves, right? And I'm getting ready my stuff, okay? And also make sure to cover them because that's always dignity of the patient, right?
Yeah.
Just expose the thing that you have to do, alright? So when you open this thing, make sure to check any yellowish like abnormalities in the bag,
Like
it's
used,
open, it's
wet.
used, you're not allowed to use it. And then you just rip it there and then make it toothpaste, okay? I don't need this one. I think you have it there, right? This one I have to put here beside the patient. I don't know how to do it. Right? Oh, and this one you can use as a garbage too. Just put beside you. Not too far, not too close, because you're not allowed to bend if you do sterile already, right? And now this one, not yet.
Not yet.
So I open this thing away from it first, and then side by side, make sure to avoid 1 inch contamination, right? Then
Okay.
do not bend, okay? This one, always adjust. 1 inch border is already contaminated, so be careful about it, right? Now you can put this thing here.
Too far in.
Too far for you? Oh, okay, half of it?
Sure, because you're going to be holding up to here. This
Oh,
is
yeah.
contaminated up to here.
Okay.
So you can only put in the stuff that's uncontaminated.
Oh, yeah. So I
Okay.
have to inventory my thing first before I put it on. I have this thing. This one can stay, right?
Yeah.
Right. So I just leave it there. Now too far. Too far. So this one you have to open a banana peel, right? 3D.
Yeah, banana.
And then this thing, this still have a plastic inside.
Yeah.
So you just drop it. Do
Yeah.
not like they don't
Yeah,
want like
just
that.
drop.
Then this one drop. Whatever in there.
Yeah, don't put your
Don't put your hand down.
Yeah.
And this one, be careful all the time because they don't want you to be. Open it. Check for the expiration date. For chlorhexidine, it's gonna be 28 to 30 days. Always check if there's
Pretty
any
thorough.
abnormalities there, or like if it's dirty one. You can pour a little bit in garbage too. Then pour a little bit, not too high, not too low. Do not make your sterile field wet.
Yeah.
And then set aside. Now I can get ready my gloves, right?
Yeah. Now you can remove.
Alright, so
Oh, you didn't. Oh, yeah, never mind.
later because I have to lubricate later, right?
Yeah.
So when wearing my gloves, I have to start in my non-dominant hand first. Is it, Preeti? Which side did you start, left or right?
I use my right hand.
Right first, right? So it's easy later, right?
Yeah.
So
Then I can
you be
adjust.
careful with gloves. Do not touch anything out of there.
Yeah.
That one, just leave it like that. Do not touch the skin.
Yeah.
And this one,
Yeah.
you have to do hitchhiking.
Yeah.
And then put it inside. Oh shoot. This is very...
Make sure you don't tear it like Chris.
Now you can fix it because sterile to sterile is okay. Right?
Yeah. Sterile to
But
sterile.
this hand, you don't need to bend it, pull it down, okay? Are we allowed?
No. Yeah,
just leave
from
it
here, yeah,
right?
because
But inside you can
yeah.
touch your skin, right?
cannot inside.
Now this one, just drop it in the garbage. Do not put your hand down all the time, remember? On this one, I have to lubricate my thing, right? So
First, you can put the drapes on because
oh
your
yeah,
hand
because
will
I'm
be
gonna
dirty.
make it dirty later. So drape.
And make sure you don't put the catheter on two sides because 1 inch is considered.
Oh yeah. Sorry.
Yeah, put them in the middle
Yeah, so-
to be sure.
So now this side is shiny part. Do like that. Drop it. If you wanna fix it, just touch in the middle. Do not touch in the 1 inch border.
Yeah.
Okay. And this one too. Shiny side. I don't have my shiny side. I think I
Yeah,
have wrong
it's
side.
hard to find shiny side.
So
on the-
make sure not to like be careful.
Yep.
Do not touch the legs. Touch
Yeah.
in the middle.
yeah.
Okay. Now I have to lubricate my thing. So I'm lubricating this. For female, it's gonna be 2.5 to 5 centimeter, right? For male, it's gonna be 12.5 to 17.7. And then if you have any thing inside, you just flick it. This will affect the. We'll stuck something there. And then put it back here. I don't need this one, right? Now I'm ready. So put your thing here. Okay. I have to give a quick clean. So this hand, I have to sacrifice this hand. It won't go anywhere, okay? So Mr. David, it's a little bit cold, okay? Wipe down, drop. Do not put your hand so high. Do not put too low. Wipe down, drop. Wipe down in the middle. Drop. If it's a male, clean the meatus first, right? 3 times too. And this one go in the garbage, and this one will go in sharp container later. Now I can start my catheter. Put closer a little bit.
You need to put this out first.
No, he doesn't want you.
You need to put this out because.
Oh
the
yeah,
urine
because it
will
will pee,
come.
right? Sorry.
Yeah.
Now, Mrs. Smith, I have to put it on, okay? A little bit comfortable, but uncomfortable, but it's gonna be okay. All right. So make sure it's too big. The hole is too big.
Because this is for the cesarean.
Don said he will ask this. So what if you put it in the wrong hole
Well, leave it there. You don't need to touch it anyway.
and then you don't have catheter anymore? So what
You
are you gonna
ask your body to get another one.
do? Okay.
Now I have to push more. If I can see a gold urine, that's the time I can advance more 2 centimeter up.
2 inches.
Inches, sorry. And now I can inflate my balloon.
Yeah.
Okay. So bear down, Mrs. Smith. Bear down.
No, you don't have to tell anything.
No, inhale, exhale.
That one is when you're putting. After you're done putting, then you don't ask anything.
Okay. What's facial grimacing? If they're feeling pain
Yeah.
or something. She looks okay. Oh God. Did I inflate it? And then
There's no water.
there is. Then
Yeah. Pressure.
sharp container.
Yeah.
And then attach my thing.
No, you can't raise this up.
Yeah. Sorry. Supposed to be 15, right?
30.
30, yeah. So this one you can attach that. That's sterile. This is very hard, I don't like this one.
Put it down because it's a urine cut. Yeah, that's good.
It's easy. You know, next time if you pick this one, you're paying this. Okay? Make sure to put it really well because when they poop or they go strain, will just pop out, right? Now, for female, it's gonna be letter C. And then put it here. If for male, it's gonna be letter S. Okay? It's not really working, guys.